percent of Georgia's deaths due to COVID-19. To put that number in perspective, we have now provided at least one vaccine dose to nearly 60% of Georgia's elderly population. This is one of the highest percentages of any state in the country, with the national average being at 49%. The data shows that these are the most vulnerable Georgians to COVID-19, and thanks to the efforts of our private providers and our public health workers, we have made significant progress in protecting them from this deadly virus. As the state was facing limited supplies of the vaccine from the federal government, it was vital that we prioritize those who are most at risk of hospitalization and death. These are no doubt tough decisions, but I believe that our approach has been the right one and ultimately has saved lives. But thankfully, we're seeing an increased supply. Allocation will be over 223,000 doses. That is up from 190. As of today, over the last 28 days, we have administered 1.1 million vaccine doses. And according to the Department of Public Health's website, we have administered nearly 8. We expect to have those 83,000 doses this week. We will be prioritizing those doses for our educators to expedite a full 5 days a week return to the classroom. Dr. Toomey and DPH have been partnering with the school systems on this plan, and she'll share more with you in her update here in just a minute. As I've said many times before, every student belongs. That is my expectation moving forward, and we look forward to partnering with local districts to ensure that this happens very quickly. Both our office and the Department of Public Health have received numerous questions about how different media outlets and federal websites in Georgia's standing in those rankings. With the data that I just laid out, I believe that we have done more than most any state to protect those who are most vulnerable to COVID-19 with the limited supply that has been given to us by the federal government. I'll also add that the Department of Public Health utilized roughly half of our first dose allocation last week as second doses to ensure Georgians who had gotten their first shot received their booster shot on time. This increased need for second doses for many providers across the state was the result of intense demand here in Georgia when we first expanded eligibility back in mid-January. This created a large number of seniors and frontline healthcare workers who needed their second dose in a very short period of time. This reallocation by the state to meet that need is the primary reason why over the last few days, Georgia's numbers of first doses administered have slowed in comparison to other states. We expect those numbers will improve very shortly, especially with the expanded eligibility occurring next Monday, March the 8th. But we can and should do more to make absolutely certain more doses are getting into the arms of Georgians as quickly as possible. We continue to work with private providers to ensure they are not holding any doses in reserve, given the significant improvements in the supply chain from the federal government and manufacturers, as well as making sure providers upload their vaccine data as quickly as possible so the state has accurate information about how many doses have been administered and where. Given that the state mass vaccination sites currently have 75,000 currently eligible Georgians on a waiting list, there is still plenty of demand out there. I'd like to remind Georgians that we have a wide variety of private providers outside of the state vaccination sites who are scheduling appointments for those who are currently eligible. Walgreens, CVS, Walmart, Kroger, Publix, Ingles, and many others are offering appointments at many of their locations. I would urge you to contact them as well. Dr. Toomey will cover some of the details of the new expanded eligibility that will become effective on March the 8th. in addition to the very promising COVID-19 data coming out of our long-term care facilities. I did want to briefly remind everyone that the March 8th expansion will open up vaccine to roughly 1 million more Georgians. So we definitely expect heavy demand in the first couple of weeks, as you can imagine. That's why we're announcing today that we're standing up 5 additional state-operated mass vaccination sites in Chatham, Ware, Washington, Bartow, and Muskogee counties, which will increase our weekly capacity at state sites to 45,000 doses for all 9 locations. Again, those sites will be in Savannah, Waycross, Sandersville, Cartersville, and Columbus. All sites will become operational on March the 17th in advance of an additional expansion of vaccine eligibility criteria in the second half of this month. As Dr. Toomey and I covered last week, specific details of that expansion will be announced in the coming days in order for Georgians and providers to plan ahead. With that, I'm going to turn it over to Director Stallings for more updates on the new sites. Director Stallings.
Thank you, Governor. Good afternoon, everyone. First of all, I want to start off by thanking our private and our public sector partners, as well as the staff of the site for their tireless efforts. Our number one goal at the beginning of this was shots in arms, and we could not do it without the helps of our partners. Again, FEMA, Department of Public Health, and Dr. Toomey and her team have been instrumental in our success, our DOD partners, as well as the private sector that we're working with. Since the sites opened last Monday, we've administered 24,924 first doses, which we're very proud of. The total number of appointments this week is 17,496, and to date, we've received 243,000 pre-registrations, which we are very excited about. That lets us know that the sites are working and folks are finding their way to the website. In addition to the 4 sites that we already have operational, as the governor mentioned, we're adding 4 sites. To be more specific, we'll be at Lake Point Sports Complex in Bartow County, Gulfstream Aerospace in Chatham County, Columbus Civic Center in Muskogee, the Waycross Mall in Ware County, and the Word of Life Church in Washington County. The site at the Gulfstream Aerospace facility is a result of a partnership with Gulfstream Aerospace Corporation, and we're extremely grateful for their hospitality there. As the governor mentioned, these sites will begin on March 17th. With the opening of the additional mass sites, we'll have the potential to administer a minimum of 20,000 more dosages a week. As Dr. Toomey will explain in just a moment, the extended eligible criteria will begin on March the 8th, but pre-registration can still happen at myvaccinegeorgia.com. Once you've pre-registered, you'll be notified when you're eligible to schedule your appointments, so no need to keep going back. We'll get to you. If you're not currently eligible to receive the vaccine, you can still sign up, and we highly encourage Georgia residents to schedule their vaccine when it's their turn. The more Georgians that are vaccinated, the safer the state will be for all of us. The mission of our agency is to protect the lives of Georgians, and we're thankful to Governor Kemp and his team for giving us the opportunity. Dr. Toomey?
Thank you, everyone. I just had a couple of quick things I wanted to update you on. In addition to the numbers that you heard, which are very encouraging, that have plateaued at a lower level than they had been, and we hope will continue that way. As I mentioned last week, long-term care facilities have really shown dramatic improvement, which I think reflects the hard work that we did to ensure that residents of long-term care facilities were vaccinated. And like we saw in the national trends, that the data from DCH, which includes nursing home personal care homes and assisted living facilities, there's been an 87% decline in cases and a 71% decline in deaths. And we aren't seeing the kind of outbreaks there that we had seen in the past. And data from HHS and CDC, which just covers nursing homes, similarly shows an 82% decline in cases and deaths, and are beginning to trend down about 10% at this time. And you can see behind me are graphics that demonstrate both these trends, both in the long-term care facilities and the combined DCH graphics. And this is both nationally and a trend here. And I think this is reflective of not only the work that we did there, but also is a predictor of what's going to happen statewide because of our vaccine efforts. As Governor said, we will be opening up on March 8th to additional categories of individuals, and we want to be sure that people understand that they can register, as you heard, as well as on our website, which has a scheduling tool on the vaccination page, and that will be fully statewide by next week, and will be up and running and ready to schedule by Sunday evening statewide. The expanded eligible populations include 500,000 educational workforce, so that would include teachers, as well as bus drivers and others in the school who may be there with the students and assisting with the school openings. Adults and children with intellectual and developmental and children with intellectual and developmental disabilities and caregivers. And it's the adults who are with intellectual and developmental disabilities that we will be vaccinating at this point in time. A developmental disability is characterized by limitations in intellectual functioning or adaptive behavior. And so this would be everything from an individual with cerebral palsy or an adult individual with Down syndrome. But in addition, we will be vaccinating those parents of children with severe complex medical conditions. And we felt this was important because they are in many cases serving as a caregiver to these children who themselves are at high risk for COVID. And because the vaccine cannot be given to children yet, we wanted to ensure that they were protected. So these medically complex children will include everyone from children with complex cell disease to obesity. These are the children who are likely to suffer complications or even death if they become infected with COVID, as well as many other familiar conditions in children, such as malignancies on chemotherapy, severe to moderate asthma, or cystic fibrosis. And we will have this all outlined on our website. And as we move into subsequent categories of not just parents of these children, but also adults and future rollouts, we will make sure to itemize these so there won't be any confusion of who might be eligible. So that's kind of a quick summary of where we are, and I'm happy to answer specific questions. And all this will be outlined well ahead of time, so there's not be confusion, as well as on the scheduling tool. We'll have these various categories outlined so that there will be clarity about your eligibility or the eligibility of a parent of a child. Thank you.
All right. Got any quick questions?
Governor, there's been a lot of action on voting here.
All right, you have been listening to Georgia Governor Brian Kemp along with Chris Stallings with GMA and also Dr. Kathleen Toomey, the DPH Commissioner, talking about the expanded rollout and also announcing 5 new mass vaccination sites starting on March 17th, including one in Washington County. That will be at the Word of Life Church in Sandersville. So Central Georgia will have 2 mass vaccination sites. Of course, the Macon-Bibb County side, the Farmers Market on Eisenhower Parkway, and starting March 17th at the Word of Life Church in Sandersville. The governor says the numbers continue to trend in the right direction, and they are now anxious to get more shots in more arms. Starting Monday, when the criteria expands and teachers and staff are eligible, the governor says starting Monday, 1 million more people statewide will be eligible to get the COVID-19 vaccine. And that's why he says it's important that we continue to get more and more doses. He says as of next week, there will be over 223,000 doses of the COVID vaccine coming into the state. And the governor says that number continues to bump up. Of course, much more on the state of the vaccine and what the governor had to say coming up a little bit later on 13 WMAZ News at 5 and 6. We now return you to your regularly scheduled programming.